Welcome to today's radiology lecture where we will be diving deep into the fascinating world of medical imaging. Radiology plays a crucial role in diagnosing and monitoring various medical conditions, using a range of techniques including X-rays, CT scans, and MRI scans. In this lecture, we will explore the principles and techniques behind radiography, focusing on topics such as radiation and radiography, X-ray machine components, image formation, radiographic positioning and techniques, radiographic anatomy, contrast agents, image quality and artifacts, radiation safety, digital radiography, fluoroscopy, and special considerations. By the end of this lecture, you will have a comprehensive understanding of the fundamental concepts and practices in radiology. So let us begin our journey into the captivating world of medical imaging. Radiography is a diagnostic imaging technique that utilizes X-rays to create images of the internal structures of the human body. X-rays are a form of electromagnetic radiation, consisting of high-energy photons that can penetrate through soft tissues but are attenuated by denser structures like bones. This differential attenuation allows for the creation of detailed images of the internal anatomy. To produce X-ray images, an X-ray machine consists of several crucial components. Firstly, there is an X-ray tube which generates the X-rays by accelerating electrons towards a metal target. This process, known as X-ray production, leads to the emission of X-rays. Additionally, there is a high-voltage generator that supplies the necessary voltage to accelerate the electrons. Furthermore, an X-ray tube housing, collimators, and filters are also integral parts of the X-ray machine, ensuring proper X-ray beam production and radiation safety. The production of X-rays occurs through two primary mechanisms: Brahms-Strahlung and characteristic X-ray production. Brahms-Strahlung X-rays are generated when electrons are decelerated or deflected by the metal target, resulting in the emission of X-rays with a continuous spectrum of energies. On the other hand, characteristic X-rays are produced when inner shell electrons of the target material are ionized and outer shell electrons fill the vacant positions, releasing energy in the form of X-rays with discrete energies. The formation of X-ray images involves the transmission of X-rays through the patient's body and subsequent detection of the transmitted X-rays on a detector. This detector can be either film-based, analog, or digital. In analog radiography, the X-rays expose a film that is processed to create a visible image. Digital radiography, on the other hand, utilizes a digital detector that converts X-rays into electronic signals, which are then processed by a computer to form the final image. Accurate positioning of the patient and employing appropriate radiographic techniques are crucial for obtaining high-quality diagnostic images. Radiographers carefully position patients to ensure the target area is aligned with the X-ray beam. Techniques such as the anteroposterior, AP, posteroanterior, PA, and oblique views enable the visualization of different anatomical structures from various angles, providing comprehensive diagnostic information. A solid understanding of radiographic anatomy is essential for identifying normal and abnormal structures on X-ray images. Knowledge of anatomic landmarks and variations in anatomy aids radiologists in interpreting images accurately. Radiographic anatomy encompasses the study of the appearance of various organs, bones, and soft tissues on X-ray images, helping to identify pathologies and guide diagnoses. Contrast agents or contrast media play a vital role in radiology by enhancing the visibility of certain structures or tissues during imaging procedures. They can be administered orally, intravenously, or through other routes, depending on the procedure being performed. Contrast agents contain substances like iodine or barium, which have differing X-ray absorption properties compared to surrounding tissues, thereby improving the visualization and differentiation of specific structures. Image quality in radiography is influenced by various factors such as resolution, contrast, and noise. High-resolution images provide sharper details, while appropriate contrast helps in distinguishing different tissue densities. However, certain factors like motion, scatter radiation, and equipment malfunctions can introduce artifacts that may affect image quality. Understanding these artifacts helps radiologists interpret images accurately and avoid misdiagnosis. Radiation safety is of utmost importance in radiology to protect both patients and healthcare professionals from unnecessary radiation exposure. Strategies such as radiation shielding, optimization of exposure parameters, and adherence to radiation safety guidelines help minimize radiation risks. By following the principles of ALARA, as low as reasonably achievable, radiation doses can be kept within acceptable limits without compromising diagnostic image quality. Digital radiography has revolutionized the field of medical imaging, offering numerous advantages over traditional film-based radiography. Digital detectors capture X-ray images directly and convert them into digital signals, eliminating the need for film processing. This allows for faster image acquisition, manipulation, and the integration of digital images into electronic medical records. Moreover, digital image processing techniques can enhance image quality and aid radiologists in diagnosis. Fluoroscopy is a dynamic imaging technique that utilizes continuous X-ray exposure to visualize real-time movement of internal structures. It offers the ability to observe the function, motion, and flow of certain anatomical structures and contrast agents. Fluoroscopic procedures include barium swallow studies, gastrointestinal examinations, and angiography. Proper utilization of fluoroscopy requires skilled operators to minimize radiation exposure while obtaining valuable diagnostic information. Radiology encompasses various subspecialties that involve specific considerations and imaging techniques. Areas such as pediatric radiology, interventional radiology, musculoskeletal imaging, and neuroradiology require specialized knowledge and expertise. Each subspecialty presents unique challenges that radiologists must navigate to provide accurate diagnoses and ensure optimal patient care. In conclusion, radiology is a vital part of healthcare that involves using radiation to create images for diagnosing and treating diseases. Medical professionals need to understand the principles of radiography, X-ray machines, image quality, and safety to effectively use medical imaging for diagnosis and treatment. Ongoing advancements in radiology lead to better patient care and medical breakthroughs.